Good afternoon. I'm Dr. Sreekanth Appasani, Consultant Interventional Gastroenterologist, KIMS Hospital, Secunderabad. Today, we'll be discussing about a special type of endoscopy, third space endoscopy, and its role in the present treatment modalities of gastrointestinal diseases. Now, what exactly is this third space endoscopy? What is this third space? So, is there a first space and a second space? Yes. There are two spaces which are already used by the gastroenterologists and the surgeons. One within the intestinal lumen and the other one outside the intestinal lumen, which are used for endoscopy and laparoscopy. So this third space is something between these two, meaning within the intestine and outside the intestine. We call this the first and second space. The third space is within the wall. That means we do endoscopic surgeries and procedures inside the wall of the intestine. That is known as a third space endoscopy. Why is it a new frontier? Because it has overcome the previous challenges of removing a part of the food pipe or the intestine without compromising the integrity of it. So I'll try to explain about it in detail later on. But I would like to enlighten the fact that we are able to diagnose many diseases in the early stage itself these days, thereby enabling us to treat them using endoscopic methods. What are these? The cancers typically used to present in a much later stage in the earlier era because the diagnostic modalities, that is the treatment for them, the tests for them was not commonly available, or these patients used to come to the hospital quite late. So these modalities were diagnosing these cancers in a pretty late stage when it has already spread to the surrounding areas. Now, with endoscopy being commonly available, people are getting endoscopy done for simple problems like gastritis and acidity. Thereby, these patients of cancers are being picked up more early. How? These days, we have got something which is known as a special type of endoscopy, optical endoscopy. That is, our normal light has got several colors, pure, we talk, violet, blue, green, red, yellow, etc. Now, if we cut down one of this light, that is the red color, and see the intestine, then we see a different pattern. In this different pattern, we are able to pick up cancers more early. We are able to pick up some diseases more early. This is known as an optical endoscopy. With the Olympus endoscopic systems, it is known as narrowband imaging, NBI. In the other systems, it is known as PICE. It is known as BLI imaging, or it is known as other types of optical endoscopies. Now, what is the advantage of this is that it cuts down the red light, thereby making the other parts more prominent. So the early tumors and early cancers are being picked up these days. The traditional treatment for any of these tumors and cancers in the olden era was surgery. That is, removal of that part of the body, whether it is intestine or any other. Now, if we are able to diagnose it early, that is, before it has spread, even within the wall of the intestine, the wall has got so many layers. So within the wall, if it has not spread, then we can actually avoid the whole surgery, removal of the whole intestine. We can only remove these layers which are infiltrated by the cancer and leave the rest of it. So this particular technology is known as third space endoscopy. Now, what happens with this third space endoscopy? Before that, we will try to understand our intestine. Our intestine has got 4 layers, just the way we wear different types of clothes. We wear An inner, we wear a shirt, and sometimes we wear a coat over it. Like that, the body has got 4 layers. The one which is inside is known as the mucosa, which actually secretes mucus and takes the food inside, digestion, absorption, and all these things. The other part is known as submucosa. Outside it is the muscle, and serosa is completely outside, which actually covers the whole of the intestine. So now we are trying to separate these layers and treat the diseases. So how is it feasible? So this technology, which I would call as a new frontier of endoscopy, is known as the third space endoscopy. Now, what type of diseases are treated with this? As I previously told you, it is mostly the early tumors, the cancers which haven't spread outside, which haven't even spread within the wall of the intestine. They are very well localized to one place. So tumors and cancers and polyps which are coming from the intestine are best treated with these third space endoscopic procedures, provided they are early. How do we do these third space procedures and what are these called for treatment of cancers? We call them as EMR, endoscopic mucosal resection, ESD, endoscopic submucosal dissection, STER, STER, submucosal tunneling endoscopic resection. These are quite complicated. I will make it simplified for you. Suppose if the tumor is in one of these 4 layers, the first layer, what I try to do is I try to push this layer of tumor above by injecting something in the second layer and try to remove it with the help of my special knives, so that that particular tumor comes out completely. It is lifted above from the other layers. This is known as EMR. Now, if it is a different type of tumor, I actually lift it up and use a small special type of knife and try to dissect it. That is, remove it piece by piece, layer by layer, and millimeter by millimeter. I try to separate the whole tumor out and then completely remove it. This is known as EST. Sometimes it comes from the last layer, that is the third layer or the fourth layer, the third layer, which is from the muscle tumors. So what I do is, instead of removing it from there, I come from above. I dig a small tunnel in the wall of the intestine, which is known as tunneling. In the second layer, I come towards this tumor, completely separate this, remove it completely, and then I come out, and wherever I have entered the intestinal wall, I close it with the help of KIMS. This is known as STER. So these special procedures help in removal of the tumors without compromising the integrity of the wall. That means there will be no hole formation. It is the 4 layers will not be penetrated and perforated through it. So I will not be compromising the integrity of the wall, and I will be treating these tumors. Now, apart from tumors, is this third space endoscopy going to be useful in anything else? Yes. We have some diseases of the intestine which can be treated with this. One is known as achalasia cardia. Now, what is this achalasia cardia? It is an intestinal disease where the nervous system inside the intestine gets lost. So, what is this? Why do we need a nervous system inside? Before I go into the details, I try to explain how the food moves within the intestine. You gulp a swallow of food inside, it enters the intestine. That is a food pipe. Now, this bolus of food which is there here, if it has to come here, this part has to contract, and this part has to relax. Now, once this part is relaxed, this food comes over to this place. After a while, this part also contracts. This does not relax, it still remains tight, and the lower part relaxes, so that the food from here moves here. And this keeps on rotating to different parts of the intestine, so that the food is pushed forward and doesn't come back. Now, if these things have to happen, that is one contracting, one relaxing, there is an intricate nervous system, something like our electrical circuits, which connect the different parts of the body. of the intestine and tell that, okay, now it's time to relax, now it's time to contract. So this nervous system tells what to happen at what particular point. In achalasia cardia, this nervous system gets damaged. What happens is the food pipe doesn't know that it has to contract. However, because we'll be always eating in the sitting position, just like this, by the gravity, this cell phone has fallen down. Like that, when we eat, with the help of gravity, it comes towards the last part of the food pipe. Now, at this food pipe, there is an excellent gatekeeper, which is known as a lower esophageal sphincter. This lower esophageal sphincter is a tight sphincter which prevents the food from the intestine. There is the stomach coming back into the food pipe. Now, it is always contracted. In a normal person, this nervous system will tell, hey boss, now it has come, please open up. So it opens up and the food has come and the food goes aside and again it contracts. Now, in achalasia, this nervous system is gone. So the sphincter, the gatekeeper, doesn't know that the food has come there. So it doesn't open up. So the food stays there and food doesn't go inside. So this is known as achalasia. The conventional treatment was, we used to put balloons and then stretch it and tear the muscle, or we used to do a surgery and cut the muscle. Now with this third space endoscopy, we are able to dig a tunnel through the food pipe, go and cut this gatekeeper and make it open so that the food which comes with the help of gravity also goes into the stomach. And this problem of difficulty in swallowing food, known as achalasia cardia, gets treated. Now, what is the advantage of this third space procedure over surgery? This third space procedure for achalasia cardia is known as POEM, P-O-E-M, per-oral endoscopic myotomy. So in this, the advantage is that we can cut the muscle directly under patient with great precision. And since it's an endoscopic procedure, you can discharge the patient the next day and the patient can start eating food, that is drinking juices, etc. from the very next day itself. So we have reduced the amount of pain the patient is undergoing. We have reduced the amount of time the hospitalization is happening. There is a patient staying inside the hospital. And we are resuming food faster by doing this third space endoscopic procedure known as POEM for achalasia cardia. In fact, to be precise, it's much better than the balloon dilatation. And it is as good as surgery for some procedure, from some cases. And in some cases known as type 3 achalasia, this POEM is much better than surgery. Now, where else this third space procedures have been used? We know a very common problem known as acid reflux, acidity, something coming in the food pipe and burning and causing throat and chest discomfort. That happens because the same gatekeeper is not getting attacked, but it is actually relaxed way. So, with the help of a special procedure through this third space known as ARMA, anti-reflex mucosal ablation, we are able to tighten it, this gatekeeper, the lower esophageal sphincter area. What we do is we inflict a scar, we ablate the mucosa on the stomach side near this gatekeeper area and create an ulcer around that area. When an ulcer heals through the natural course, it causes a scar and the junction becomes tight. And thereby the acid reflux comes down. So with this help of this third space endoscopic procedure known as ARMA or ARMS, we're able to tighten up the lower esophageal sphincter and reduce the amount of reflux. So these third space endoscopic procedures, which I have called as a new frontier of endoscopy, has revolutionized the treatment of early cancers, achalasia cardia, and reflux problems also. With the help of these procedures, we have reduced the amount of morbidity, that's the pain which the patient undergoes, and the hospitalization costs, and more importantly, we are recovering the patient faster for an early mobility.